Don and the rest of us were at the Physicians for a National Health Program conference 2 weeks ago. We sat down in a little huddle and we talked about, well, who should talk about what? He wanted to volunteer to talk about the Republican health care proposals because that's what we'll be hearing a lot about in the next 4 years at least. So I volunteered, and I kind of feel like a homeowner who decided to fix his own overflowing sewer pipe, wandering in and learning to use pipe wrenches and all this stuff. I'm learning a lot, but it's definitely a work in progress. So this outline that I passed out is really bare bones. One thing that I want to emphasize at the beginning is that there is no Republican health care proposal that is fixed and set and ready to go yet. Paul Ryan probably has the most agreed upon proposal, which is called A Better Way, which I sort of waded through over the last week or two. It's 37 pages. It's not that hard to read. It's full of shit, like my basement. But it's probably worth looking at. I tried to make an outline of what's in there and what's been floated by other Republicans, and we'll have a few words about the new nominees for Health and Human Services and the CMS toward the end. I was about to read Bobby Jindal's proposal for health care, but thank God he wasn't nominated, so I didn't have to read that. So Tom Price actually did have a proposal, which we'll get to later, that became more or less incorporated into Ryan's proposal. So, starting out, Medicare reform, they're not really calling it a voucher anymore. They're calling it premium support. And again, anybody who knows more about this, please feel free to chime in. But according to Ryan and what I've heard lately, what it is, it's essentially a voucher, but premium support means that beginning in 2024, Medicare beneficiaries will be given a choice of either a private plan or traditional fee-for-service Medicare. And the payment would be made not to the beneficiary, but directly into whatever plan they choose. And the amount of the payment would be based upon the average bid of competing insurers. So taking a pool of people who say offer Medicare Advantage private plans, they would average that bid and pay that to whichever insurance plan the beneficiary chose. Really big on strengthening Medicare Advantage, which is, of course, the HMO privately managed form of Medicare. There are a lot of acronyms and a lot of Republican buzzwords. Value-based insurance design, or VBID, meaning that these different Medicare Advantage plans can offer a flexible package of benefits, thereby tailoring the cost to the beneficiary, but hidden language is that the benefits don't have to be comprehensive or basic like Medicare now mandates. So they could change the benefits package, sell it to somebody who's 65 or 66, who expects, hey, I'm healthy, I don't need all this extra stuff. And then 5 years later, they wind up with diabetes or they've had a heart attack and things change. So definitely privatizing. There's a big push to privatize Medicare, and the way that they're the other thing is I do want to say, in response to Barry's suggestion that they may be doing this by next year. I think the latest thing I've heard is that they're not eager to challenge Medicare this year or next. They're probably going to, the phrase was, we don't want to lead with our chin. So I don't think they're going to attack Medicare immediately, but I think it's definitely being talked about. They are going to, I think, repeal Obamacare as soon as possible, but by doing so, Obamacare did affect Medicaid and Medicare, so they will have to take that into consideration. So it's a very complex a very complex system that they're looking at, and it's gonna be a lot of struggle, a lot of debate. Medigap is, of course, Medicare supplementary insurance, and I think they're going to try to weaken that so that people either have to choose between traditional fee-for-service Medicare or Medicare Advantage, the health HMO type Medicare. So they're going to restrict cost sharing for the Medicare supplementary plans. They're going to combine, they're proposing to combine Medicare Parts A and B, have a single deductible, streamline savings programs, and set an out-of-pocket cap. There's a lot of vague language in here, which I didn't know exactly what they're talking about, and please, anyone who knows more, please raise that. They talk about protecting the doctor-patient relationship by having patients contract with providers for care of non-covered services under Medicare, whatever that means. They're gonna have a website called Medicare Compare in which they post quality and cost indices for both Medicare Advantage and fee-for-service plans. And supposedly this is going to allow transparency of decision-making so that people can choose which plan is the most effective or the cheapest. So our metropolitan statistical area here is San Francisco, Oakland, and Hayward. So that would be lumped together to show quality and cost data. They're talking about matching Medicare eligibility with the Social Security retirement age, which, as most of you know, is going up slowly, 66, and it's supposed to be 67 in a few years. So they're going to link the Medicare eligibility with that. Okay, so Medicaid reforms. We've always, I didn't realize, yes.
When you just said link.
Aren't they doing that now?
So that's something I don't know for sure. Is the Medicare eligibility age 65 still? I thought it was.
Yes. No, it's 60. When I just sent out Medicare, they said to actually get well part of Social Security, I could take Medicare at 65, but then my Social Security would be kicking in for 11 months.
Right.
Everybody born after me would have to wait 12 months. And in 2 years after where I was born, I had to wait 2 years. It's still
So
living Social Security.
Well, let's not get. I don't want to get bogged down. I don't want to get bogged down in the details because these will change and there will be a lot of debate. But what I understand right now is that for people born between 1943 and 1954, the full benefit for Social Security is at age 66.
Correct.
And then, and people born after 1960, it'll be 67. And they're talking about linking the Medicare eligibility to that age.
Thank you.
Yeah. All right, so Medicaid reform. So what Ryan has proposed in a better way, which came out in June of this year, is that block grants are still an option, but he's also talking about per capita allotments. So in a block grant, funding for each state would be given as a single grant, a single fund, based on the year. If a state expanded Medicaid, it would be the year before that happened. So whatever the funds were pre-expansion, that would be the monies allocated every year to that state. And the spending of those funds could be determined by the state for whatever program it felt could meet health care needs. I mean, it might be a new highway that was nearby a clinic or something like that. So, I mean, it really is a lot, it turns Medicaid over to the states. So Ryan's proposal says we can, a state can either request a block grant or per capita allotment. Now, a per capita allotment would begin in 2019, And the allotment would be based on the average 2016 expenditure for that state and adjusted for inflation over the 3 years in between. States that did not expand their Medicaid services would not be able to expand it after this per capita allotment. States that did expand would have initially the same funds that they got after expansion, but after a couple of years, their matching federal monies would be scaled back. Okay.
So they're being punished for it?
They're saying, well, you can start with that much, but you're not going to get that much going forward. So,
Would that be based on a percentage? Like, say, scale back 5%?
yeah,
or
so the other thing about Ryan's proposal is there are no numbers in it. It's not, he doesn't say that 2% the first year and 4. It's just kind of vague. Yeah. So everybody loves the Children's Health Insurance Program, CHIP. And under Obamacare, the federal support for that program increased from a baseline of about 65 to 85% to 100%. So with a lot of sort of difficult to understand wording, Ryan basically said, that ain't gonna happen anymore. We're taking it back to where it was before. And he made it sound like he was doing everybody a favor. He was saying that, you know, there's all these rich kids that are getting CHIP, and we're just going to go back so that the really needy kids will get it. So by turning over either in the block grant or the per capita allotment control over Medicaid to the states, he and this document was not just the product of Ryan. He vetted this with House Republicans and some Senate Republicans. So this is a collaborative effort, and I think represents the closest thing we have to a Republican strategy going forward. So the idea is that by shifting management of Medicaid to the states, it would allow the states to inflict requirements on Medicaid recipients, such as requiring that able-bodied adults be employed, seeking a job, proving that they're seeking a job, participating in education, training, or a community program, setting premiums for Medicaid. So not only would you have to prove that you were looking for a job, but you'd have to pay in money every month. And we'll get to an example of that in a minute. Reducing the income eligibility for Medicaid below the current 138% of the federal poverty level. So really some serious changes that they're hoping for there. So then there's a few other topics that I hope I'm not taking too much time.
You're doing great.
Okay. So I'm just going to run through a few other topics that you will hear in the debates about health policy. I think everybody here is very familiar with high deductible health plans. That's, you know, one way that the Affordable Care Act was able to, you know, expand health care for people between Medi-Cal and employed health insurance is by offering these less expensive by premium policies, but very high deductible. So what we're talking about is for individuals, that means a $1,300 per year deductible, up to $6,500 a year for families, minimum $2,600 deductible, or up to $13,000 a year, which, as you know, is pretty crazy. I have lots of patients with those kind of deductibles who come to me for their preventive office visit, and that's covered, but you know, if I try to order any lab tests that aren't strictly preventive, they can't do it. They can't afford medicines. They're just like, what kind of insurance is this? So these high deductible health plans are linked to health savings accounts. And health savings accounts, of course, you know, for people that are employed, part of their payroll is put into it, and the employer puts some payroll into it. And about a quarter of all workers were enrolled in health savings accounts last year. The idea is that that money would be used to pay the high deductible, but there are oftentimes limits to how much can go into those health savings accounts, like $1,100 is a typical amount, and that doesn't even cover the deductible. So this is a very popular idea with Republicans. They want to offer a lot more of the high deductible health plans with the health savings accounts. Another common theme is tax credits replacing subsidies. So whereas Obamacare offered premium support for people who are in that buying bronze or silver plans, tax credits would replace those subsidies. Cross-state insurance plans, Trump talked about that a lot when he was campaigning. The idea is that if South Dakota has a cheaper plan with fewer benefits to offer in North Dakota, then people might buy that and it would foster competition. It might reduce the cost of health care and widen consumer choice. Again, the risks being that you get these plans out there with very minimal benefits. The provider networks from South Dakota trying to market in North Dakota might be very substandard. So by saying that consumers have more choice, most of us, I'm a physician, I can't even understand some of these plans. Trying to figure out, the provider networks, the deductibles, the co-payments, the premiums, and I wouldn't expect my patients to have a clue on how to decide between some of these plans. Tort reform, everybody knows Republican lawmakers are very eager to lower non-economic damages and total damages. They think that's going to be a way to lower healthcare costs in defensive medicine, doctors ordering too many tests to cover their asses. But in reality, studies have shown that does not really lower healthcare costs that much. In conclusion, I did want to mention about Donald Trump, and many Republicans feel like pre-existing conditions, the idea that you can't be denied health care because you have a condition that existed before you applied for a policy, that should continue to be, that should not be a factor in excluding people from insurance. And the idea that children up to the age of 26 should be covered under their parents' policies. These are very, very popular ideas, and most Republicans do not want to fight with that. And, again, just like Medicare, they're very reluctant to challenge those. There was a Kaiser poll that just came out a couple days ago, which asked, Americans about if they had a favorable opinion about many of the features of Obamacare, including the age 26 thing and pre-existing conditions, eliminating out-of-pocket costs for preventive services. The average total favorable response was about 80% in this poll, about 90% average for Democrats, but really 70 to 80%, 60 to 70% among Republicans. These are very, very popular things. It's like, keep your government hands off my Medicare. Well, think about it. I know you hate Obamacare, but you like all this stuff that it did for you, right?
Yeah.
So I'm just going to wrap up with a couple of comments on our new nominees for Health and Human Services. Tom Price is an orthopedic surgeon who was based in Atlanta for many years. He became a state senator in 1996 and then U.S. House of Representatives in 2005. He succeeded Paul Ryan as the chairman of the House Budget Committee in 2015. A long history of conservative values. He wanted to prohibit funding for National Public Radio, wanted to terminate the Emergency Mortgage Relief Act, he wanted to extend the U.S. Patriot Act, he opposes abortion, gun control, any global warming legislation that raises taxes, and gay marriages. So his Healthcare Act was the Empowering Patients First Act, which he introduced in the House in 2009. And it actually was incorporated into Ryan's document. So this is, again, it's a collaborative document. And then just wrapping up, the nominee for Center for Medicare and Medicaid Services is Seema Verma. She's of Indian origin. She's a Master of Public Health. She founded SVC, which is Seema Verma Consultants, in 2001, and has worked with several states to redesign Medicaid in those states. Just one example of her work is in Indiana, where she worked with the Healthy Indiana Plan and basically introduced a high deductible health plan, which required a contribution to the health savings account, and she called it the POWER account, personal wellness and responsibility. So $1 million from Hewlett-Packard that year. During the period when Hewlett-Packard was a major Medicaid vendor and made $500 million from Indiana.